desensitization, and reprocessing in the treatment of post-traumatic stress disorder. EMDR is a psychotherapy technique introduced by Dr. Francine Shapiro. This is done through 8 phases with a licensed EMDR psychotherapist. Studies have shown that among single trauma survivors, 84 to 90% showed no post-traumatic stress disorder symptoms after 3 90-minute sessions. Among multiple trauma survivors, 77% showed no PTSD symptoms after just 5 90-minute sessions. But what is PTSD? Post-traumatic stress disorder is a trauma and stress-related disorder according to the Diagnostic and Statistical Manual, DSM-5. It occurs after a trauma, such as sexual assault, combat, car accidents, or natural disasters. There are multiple criteria to be met to receive this diagnosis. The term survivor is a preferred word to victim, as it has much more positive connotations. Among Americans, 6.8% will be diagnosed with PTSD within their lifetime. Among male Americans, that's 3.6%, and among female Americans, it's 9.7%. That's almost 1 in 10 women. The phases of EMDR involve phase 1, which is the history-taking phase, where the practitioner and survivor discuss the traumas. This will be used to determine the length of treatment, which is based upon the number of traumas, the age of PTSD onset, and any other comorbid or underlying conditions. Phase 2 involves teaching healthy coping mechanisms, such as grounding or meditation. This allows the survivor to practice these, which helps them to maintain a healthy state of mind both during and in between sessions. Phase 3 to 6 is where the actual EMDR part of therapy starts. The survivor identifies a specific memory, a negative belief about themselves, the emotional responses to that memory and those negative beliefs, and one positive belief about themselves. They are then instructed to focus on that memory, and the practitioner uses bilateral stimulation, such as eye movements, hand tapping, or auditory tones, to engage both sides of the brain as it processes the memory. They will then rate their distress level on a scale from 0 to 10, and the bilateral stimulation will be repeated until that distress level reaches 0. Once this happens, they will be told to focus on that positive belief about themselves, and the bilateral stimulation will be repeated. This connects the negative belief and the negative emotions of that memory to a positive belief to reduce the effects of the traumatic memory. They will continue this until that belief is held 100%. Phase 7 involves keeping a log in between sessions. This is where the survivor will record any PTSD symptoms that may come up or any other traumas that they may think about. Phase 8 is the check-in phase, which occurs at the beginning of the next session. They will review the log the survivor kept and then decide where to go from there, such as adding more treatment, ending treatment, or using different types of bilateral stimulation. In conclusion, EMDR is a very valuable technique in treating PTSD. All of the studies are showing promising results, and it is continued to be implemented and researched all the time.